this is not an anger issue. This is not a stress issue. This is not a substance abuse issue, that this is really about people who give themselves permission to be abusive. That abusive behavior is a choice. It's always a choice. Now, maybe a choice that's made very quickly and automatically, but it's nonetheless a choice.
Also want to say, if you haven't hit the like or subscribe button, please do so. We would love for you to be able to know about all the different programs that we're offering. Hello and welcome. Today I'm here with Chris Huffine, who is the owner of Allies in Change Counseling Agency in Beaverton, Oregon.
So I'm sorry, Bob, to interrupt. I'm actually the executive director. I'm not the owner, because we're a private nonprofit. Okay. Allies in Change is the name.
Thank you. Thank you for the clarification.
Sure.
Executive director. So full disclosure, I've known Chris for a very long time. He actually trained me in domestic violence treatment many years ago, and I've been consulting with Chris for, I think over 20 years now. And I have a great respect and admiration for the work Chris does. And we're going to mention this a little later, but he just published this book. We're going to let him talk about that a little later, called Becoming Allies, which I think is fabulous and very well written, but we'll come back to that. But I'll start by just asking some questions. Tell me how would you define what domestic violence treatment is, or batterer intervention treatment, or whatever term you think is the correct term to use.
So basically, I think, we call our groups abuse intervention groups, and basically they are groups for people who are struggling with being abusive, with having ongoing patterns of abusive behavior, typically to their romantic partner, but it could also be to their children or to other people. But it's an ongoing pattern that's causing them problems. Okay.
And, how does somebody typically get into one of your groups?
So most typically, for most programs that do this work, they're getting their referrals mainly through the court. And first of all, through somebody getting arrested and charged with a crime of domestic violence of some sort. It may also be through child welfare or child protective services, where they've become involved in the family and they learn of a history of domestic violence. We're seeing an uptick in referrals as a result of custody evaluations, or as a result of kind of divorce process, where, again, domestic violence has been identified, in order to have contact with the kids, or more contact with the children, they have to address this as well. And then finally, those who come in voluntarily. And we see more of those individuals than most agencies do. Most agencies that work with this population are almost only working with court-involved people, but we also see a fair number of voluntary clients, although many of those voluntary clients are coming in at the mandate and directive of their partner who has expressed concerns.
Yeah, I understand that. One of the categories that is kind of a voluntary group for me are people who are staying well past their mandate. And they're staying well past their mandate because they see it changing their life. They see their life getting better. Their relationship with their kids is getting better. Their relationship with their partner is getting better. The relationships at work is getting better. They're having more success in their life. And I just want to say, because the court mandates can be short, one of our primary goals, and I know it's one of your primary goals, is to get buy-in from the people in the group. And we focus on that really quickly. We want people to understand that this is not just going to make your families and children's life better, which is the purpose of this work, but it makes your life better too.
Yeah.
And I know you're about that. You have more voluntary groups than I think anybody in the entire planet, and that's really a testament to the quality of the work that you do. Can you walk me through what someone goes through in the treatment process?
Sure. Well, of course, first they need to come in for an intake session. So they would call our office. And while I'm talking about what we do at Allies in Change, much of what we do, it's true for any of the other programs around. There are many programs around the area, wherever, a listener may be. So it's pretty much the same, which is they would call in, they would indicate that they're interested in services, share a little bit of background on the phone about how they learned about the agency and the circumstances under which they're getting involved. And then they come in for an individual intake session. And that's to collect some background information, get a better idea of what's going on. And they'd be informed more about the program, what the expectations are to get involved, answer any questions they have about that. And then they would get set up with a group that they would join. And definitely this work, there's wide agreement within the field, is far, far more effective in a group setting. So there's just no comparison. Group work is much, much more effective than individual work for this issue. So they'd be set up with the group, and then they get involved with the group. And at our agency, our groups meet weekly, which is pretty typical, and they meet for a couple hours each week. And the group work is a mixture of kind of checking in, reporting how the week's been going, how's their self-care been, any significant life changes, has there been any new abusive behavior, things of that nature. Some time is spent focusing on present day situations that they may be dealing with or challenges. That's also where some of the homework sharing is done. And they will bring up a situation and how they handle themselves and get feedback on what they did well, what they could have done differently. And then third portion is more educationally focused, where there's typically some kind of education done or a group discussion about a particular issue and what have you. So that's typically a mixture of checking in, talking about current day situations, and then some additional education.
So if you had to pick 3 topics that you think are the foundation of treatment, what would those, the 3 concepts that you hope every person is really learning about, what would that be?
Well, I think the first is that this is not an anger issue. This is not a stress issue. This is not a substance abuse issue. That this is really about people who give themselves permission to be abusive. That abusive behavior is a choice. It's always a choice. Now, maybe a choice that's made very quickly and automatically, but it's nonetheless a choice. And what drives this is a belief system that kind of believes that the abuse is justifiable, or that it's okay, or that there's not a problem with it. So that's the biggest part of the work, is changing that belief set. Now, other things can certainly trigger the abuse, being drunk, being stressed out, feeling, like it's a difficult situation and there's no other option. Those can be triggers, but the cause is this belief system. So that's the biggest part, is changing the belief system. And probably the best description of the most common belief system is done by Patricia Evans, who wrote a series of books. Her first and most well-known one is called The Verbally Abusive Relationship. Mm-hmm. And we still recommend that book, even though it came out many years ago. It's still quite strong in describing this belief system of power over. And then the alternative is a belief system of personal power. And so a lot of the work is shifting from a power over to a personal power belief system. And then another aspect of this that I often see is that people who are prone to abuse tend to have an outward focus. They view their struggles as due to things out there, like the way their partner's behaving or not behaving, the way the kids are behaving or not behaving, what's happening in the world and how it's affecting them. And with that outward focus, they kind of believe that in order to make themselves happy, they have to control their partner, control their children, otherwise manage outside events. And that can be very challenging because they don't have that power. And so oftentimes people with that power feel pretty helpless and powerless as they try to do these things. So that's that outward focus. And it's really about helping folks shift from that outward focus to more of an inward focus, to realize that your true power is over yourself, and really how to manage yourself in these situations. And of course, if you're looking inward and managing yourself, there's no need to control others. And so that's, I think, in a nutshell, kind of some of the most important concepts. There's plenty of other things. This is complicated work, but I think if you had to boil it down to a few things, it's about not giving yourself permission to be abusive, looking at the beliefs that make it okay, and changing those beliefs. Most of all, power over, and shifting from an outward focus to an inward focus.
Yeah, I want to comment on some of that. One of the ways I describe, alcohol and stress is that increases the likelihood of abuse, but doesn't cause it.
Yes.
I use quite often. And when I would think about 2 of the most important concepts, I think of accountability and I think of addressing control. And I don't know if this is still true, but a long time ago, I had learned or read a study somewhere that said stopping abusive behavior over a length of time isn't necessarily an indicator of long-term change, but addressing controlling behavior is. I don't know if you believe that or if that's still true, but I see a great change in our clients when they really understand what control is and they understand the motivation behind it, which I think control is about fear. It's about dealing with fear or an ineffective ability to deal with fear, which I think matches everything you just said. This idea of looking inward and looking at what's going on within you and what you need to address within yourself and how you can take care of that in a healthy way as opposed to needing to put power over someone else. But anyway, I really like hearing you talk about that. You didn't mention accountability. Is accountability a cornerstone of the work you do? Or?
Sure. Well, I would say that again, within the field, that's a very common way of thinking. In fact, it's probably one of the most common words programs use is accountability. If you had to boil down, if you want to search one word to find programs that work with abusive partners, accountability would be a good search term.
Yeah.
And so there, a common way programs define accountability is really in response to. Let me back up a step. Abusive behavior has several layers to it, and one of the layers it has to it is it's not just the moment the person's abusive, it's the fact that they will deny it, rationalize it, minimize it, justify it afterwards.
Yeah.
They won't take responsibility for it. They give excuses and justifications and rationalizations. And so an important part of the work is accountability is to take responsibility for the abusive behavior that you've done, that you ultimately, you chose how to respond to a situation. That no situation makes you abusive. Situations can lead you to be upset or agitated. You can feel wronged. All kinds of things can be going on, but still about you choosing to be abusive. So the more common form of accountability that most programs talk about is that you are responsible for all your abusive behavior, and you need to take responsibility for that. And in doing so, of course, then you can make different choices. We talk at Allies about another kind of accountability, which is broader, that we call primary accountability. And primary accountability kind of expands this idea to all behavior, that ultimately you're responsible for all your choices and that you're responsible for your well-being. Now, you aren't necessarily responsible for what happens to you, but you are responsible for how you deal with what happens to you. So that we kind of emphasize that much more broadly. And I would agree with you that either way you define it, the more narrow way in terms of you're accountable for your abusive behavior, or more broadly as primary accountability, that's definitely a cornerstone of most programs. And a very important part of that of the work is to become accountable and to practice accountability.
And I think along with that is being accountable for the impact that you have on others, understanding it, becoming aware of it, and maybe hopefully developing empathy for it. Which I know that's probably a, not always an easy thing to see happen, and maybe not always a goal of every program, but I know that has been something that programs have focused on throughout.
Yeah, I would agree. I would definitely say that's another very common aspect of programs is about building empathy, for sure. And one of the things that makes it easier to choose to be abusive is if you view the other as less than, if you view the other as not human. And we know this for violence in general. Say that again?
Yes, that's back to the beliefs again.
Exactly. And we see this in violence in general. So, for example, part of military training is to dehumanize the enemy. If you see the enemy as a human being, as somebody's son or somebody's brother or somebody's, father or parent, that it's going to be a whole lot harder to want to kill them. But if they're simply the enemy or this abstract thing or this non-human thing, it's going to be much easier to practice violence. And of course, part of traditional gender socialization, especially for men, is really about not being particularly empathic, to be very kind of detached and numb and disconnected. And there are times it has its value in society, but our folks tend to take it to the extreme where they really see their partners and family members as less than human, and that makes it much easier to be abusive and controlling. So a very common part of many programs, including ours, is increasing their empathy ability. And a very, very small number of these individuals are unable to have empathy, but that's kind of one of those stereotypes that is not very accurate. The vast majority of the people we see are very capable of having empathy. They simply are so armored up emotionally that they've learned to block it, but it's there. They have the capacity for it. They've just learned how to disconnect from it. And that's the only part of our work, is helping them connect more strongly to their empathy, including the impact that their behavior has on the people around them.
Yeah, very good. Yeah. Well, let me jump to a different question. Tell me, what do you think about the concept of evidence-based practice in DV treatment?
Well, evidence-based practice has become a very common phrase.
Mhm.
And the idea behind it is that you are using methods and practices that are empirically supported. They're either supported by research that's been done by others and published and supported, or research that you've done on your own outcomes of your program. And in general, the idea of evidence-based practice is a fine idea. It's kind of the antidote to, snake oil. So the idea behind snake oil way back in the day was it would be touted as this magical elixir that can do all these amazing things without any proof, without any true evidence.
Mhm.
Just trust me on this, and then you'll see. And of course, it typically would not work. And so, in general, the idea of evidence-based practice is a fine idea, and it's become a very common phrase. People bring it out very easily. However, it has its problems, especially when narrowly defined. And probably the best line to kind of challenge it is a line that not everything that counts can be counted, and not everything that can be counted counts. Because the nature of research is to focus, because again, most researchers are academics and others who need their well-being, their livelihood is based on producing research. And so there's some incentive to do research that's going to be easier or easier to prove or quicker. And so it's kind of like the idea of if you've lost your car keys, why not look underneath a light where it's much easier to see them if they're there, than look in the dark where it's much harder to find them, even though they may in fact be in the dark.
Yeah.
And so research tends to cluster around the things that are easiest to measure and that are quickest to measure. And not that doesn't have some value, but that can limit kind of the nature of the research. And especially with this work, which is longer term, involves some more subtle things. Some of the ways to research that are not necessarily easily done. And and just because something hasn't been proven doesn't mean that it isn't effective.
Yeah.
Okay. It's more, in fact, it's only when something has been disproven that you can say that you should not be doing this. And that's a whole nother problem. There's a lot of what people do in this work is based on a long time experience that hasn't been formally researched. Most of the field has not been formally researched. It's a pretty new field. It's just been around for a few decades. And it's also an underfunded field. So there hasn't been nearly the research done. So you just have to be careful when that term is being used and what does that really mean. And people are very quick to invoke it. And quick to dismiss things that may be very credible that have not been formally researched yet.
Well, I appreciate it, because I'm being asked to talk about that here in the next couple of weeks. And so it's really good to hear your take on it. One of the ways I think about it is some of the intangibles that would be really hard to measure is the connection that the men make with each other in group and how important that is. The support they have, how they hold each other accountable, how they support each other to do the deeper work. That would take a lot to really measure that. And I think there's a lot of things like that I think are effective in treatment that are very difficult to measure.
Yeah, although I would tell you, Bob, I think that actually is one area that not so much in the DV world, but more generally, we know a lot is that, and this is research going back into the 60s, it looked at different therapeutic orientations, cognitive behavioral, psychoanalytic, Rogerian, and so forth and so on, and evaluated were they effective and what aspects of them seem to be most effective. And what has been shown over and over and over again, over decades, is the quality of the relationship you have with a therapist seems to be more predictive of outcome than any particular therapeutic orientation.
Right.
Which of course, can be a little bit embarrassing as you promote your therapy as the way of doing it. But this has been very powerful research that's been replicated over and over again. Now, most of it has not been done doing with abuse intervention work. It's been done in more general therapy. But there's certainly no reason to think that wouldn't generalize. And that goes right back to what you're saying, what you were just saying. I think that's the empirical support for what you and I have both experienced, because I would completely agree with you, is there is research supporting that the quality of the relationship that that you're going to have more effectiveness. So I think that that is an example of an evidence-based practice, even though the research was done in non-abuse intervention fields. I think there's no reason to think it wouldn't be generalizable to our field as well.
And I'm talking about not just with the therapist, but the quality of the relationship that they develop with each other in group. And I'm sure that group dynamic work has been studied also.
Yes, I think the same thing has been found. And certainly, as you said, we see this all the time. One of the things that keeps group members engaged and committed to the work is when they form a connection with other group members, when they feel some sense of community. Another important aspect of this is that what we know, again, empirically, is people who are prone to abuse tend to be more socially isolated than their peers. They tend to have fewer social connections and close social connections. And we hear this all the time, right? In our group work, this is one of the appeals of the group work, is it's a chance for some of these men to have the one place where they feel really connected, where they feel like they can really be honest and be themselves. We aren't just chit-chatting or talking about sports or current events. They can actually talk about their personal lives in a way that feels supportive and acknowledging, where they don't feel judged, and that sort of thing.
I do this thing in group where I draw this great big boulder on a whiteboard when we were in person, and I would put nurturement, closeness, trust, all the things that we value in human connection inside that boulder. And I would say, okay, underneath we're going to put the pillars of support, and we would talk about the gender difference in our culture, what the pillars of support might be for women, that they could have talk to their friends and their family and Oprah and all these other different things. And then I would say, okay, what is it for men? And it usually is their partner. And so what happens if you put all that weight on that one pillar? It starts to crack. And what happens if that pillar wants to leave or wants to go away? And we talk about the importance of that being supported in our culture, where it might not be, but in group, they do get some of that. And I know that culture and socialization are not the only antecedents to abuse, but boy, I want you to talk about, I strongly think there is a relationship between socialization and culture and media in terms of how it affects the way people think, and particularly the way men think. I wonder if you'd comment on that.
Of course. Well, I think that this is kind of the big obvious thing that gets overlooked over time, is that we know statistically that the vast majority of violence is done by men, whether we define it as murder, assault, acts of war, sexual assault, robbery. Every single type of abuse that you can think of the vast majority is done by men. The only two types of abuse that women come close to perpetrating as the same level as men are child abuse and elder abuse. The reason, though, for that, in part, is that men typically have less access to children. They may not be involved in the family, or otherwise may not have access to them, and they're less likely to step into caregiving roles for their elders. And if you're not around somebody, you can't be abusive towards them. The other aspect of this, though, is that the primary victims of men's violence are actually other men. So men make up the significant majority of murder victims. Men make up the significant majority of victims of violent crime, things like robbery and simple assault. Men make up the significant majority of war atrocities. So this is very much a men's issue. And yet we don't talk about that, about why is that, or what is that about? And some will argue that, well, that has to do with biology, the testosterone, and that's a very weak argument. It's not particularly well supported.
Right.
However, what is striking is the way that men are socialized and the messages that males get, boys and men get, from pretty much all around the world about what it means to be a man. And without going into too much detail now, really those kind of set males up for embracing abusive behavior and violent behavior. Now, thankfully, most boys and men don't do that. So we all get exposed, all males and male identified folks get exposed to this, but only some of us kind of take it to its extreme of becoming abusive and controlling. Right. Now we see this also to some extent among female identified folk as well. So again, there are some women who are abusive. They're much smaller in number than men, but they do exist. And some research that's been done with them find that they also, to some extent, embrace traditional masculine values. Now, that does not necessarily mean that they look like men or dress like men, but simply that they embrace some of those same values to be strong and tough, to be self-reliant and independent, to not lean on people too much, to be wary and mistrustful of others, to be guarded and careful and armored up. And we also see this in our groups for women who are abusive and controlling, that they also tend to embrace some of these same qualities. So I very much think this is strongly rooted in how we are socialized and the messages that we're given about what it means to be a man, that boys and men are given in particular.
Yeah.
And that's really the key to stopping this, is addressing those messages.
You know, one of the exercises I have men do in group is to look at all the different messages throughout their life they might have got about what it means to be male and what it means to how to treat women and on and on. You know, what did your coaches say? What did your teachers say? What did your parents say? What does media say? What does culture say? And I've had people push back on the idea that media has an impact. And I like to follow that up with somebody needs to inform Coca-Cola and Pepsi that media has no impact on people's behavior. Because, you know, so, and I think there's a combination of things that bring in socialization, and all of those combination of factors have an impact and are important. You know, I often ask the guys in my group, you know, have you ever seen a movie where two men have gotten in an argument with each other and decided to go outside and sit down and have a cup of tea and talk about it? Usually there's a lot of gasoline explosions involved, and, you know, and to think that men are not socialized to act with violence in a conflict is just not true. It's pervasive throughout our culture. And I agree with you. It doesn't mean that everybody becomes violent, but it certainly suggests that culture is giving permission, whether it's conscious or unconscious. And I think that's extremely problematic. And,
Yeah.
you know, and I like to tell the guys in the class that you are becoming ambassadors of change, that you will change the world. And if you don't change the world, you change your world. If you really embrace the idea of becoming respectful or choosing to attempt to be respectful in everything that you do, your world will change, and it will have a greater impact on the quality of your life. And it may impact clearly the quality of other people's lives, particularly your family and your children and other people around you. I know that in my work in the last 20 years in this field, I've seen lots and lots of change. And I know that sometimes it's hard to know how real it all is, but I've seen lots of evidence that there's real change. And I know that not all of that has been quantified, but I wondered if you could just talk about your personal experience of of change that you believe you've seen in this work. You know, how is this work effective, and how is it making people's lives better, in your opinion?
Sure. So I think the easiest thing to change that we do almost immediately is stop most of the physical and extreme abusive behavior. So, and this change literally happens the first time they walk through the door. That's how effective we are, Bob. Is all they need to do is show up at our agency, and their physical abuse stops. It stops like that. And I'm only half joking. The part that's true is it is that abrupt a change, and it's unusual actually, even among the court-involved people, for there to be new acts of physical violence. I'm not saying it never happens, but it's really quite unusual, even when you interview their victims. And I think the reason for that is not that we've in some way changed them. They know they're being watched. They're on probation, child welfare is involved, what have you. And so they're on their best behavior. Again, this goes back to the fact that this is a choice. So that's actually very easy to stop. Just keeping an eye on them is all you need to do to stop that. The real work is helping them change the more subtle forms of abusive behavior, the ones that are not illegal, like emotional abuse, psychological abuse, most verbal abuse. None of this can they get arrested for. And that's what they will continue on. And we hear this from their partners all the time. They talk about this, the stopping pretty quickly of the most severe abuse, even as the more subtle abuse continues or even gets worse. And I should make it clear that the subtle abuse is no less damaging than the physical abuse. In fact, it can be even more damaging. But this is where most of our work is and the longer term work is on topping these more subtle patterns, these more of these kind of milder forms of emotional abuse, psychological abuse, control, and things of that nature. So that's what we're looking at. Again, how can we tell somebody's changed? Well, certainly the gold standard is not whether they're getting arrested again. Oh, that's very easy to measure, which is why that's often used for evidence-based practices. Does it lower criminal recidivism? Do people not get arrested again? And that has its place, but it's pretty limited. It's a pretty crude measure. The gold standard is really, if they are still in relationship, is what is the experience of the partner and the children. And do they feel consistently safe? Do they feel consistently respected? Do they feel consistently free within the relationship? That's what we're looking for.
I would add to that, do they feel they have choices?
Absolutely. And that's probably the freedom, right? The freedom is choices. So yes, I would agree completely with that. They definitely need to have choices. Now, some of the ways they can tell whether the person has changed or not is not when things are going great. It's when things are not going well. And so really it's when they have a different opinion, is there room for that different opinion? When they have a different priority, is there consideration of that different priority? When the abusive partner is having a bad day, when things are not going well for them,
Right.
do they manage that appropriately?
Right.
Those are when you're going to really tell if there's been real change in part. Now, for us in the program, the way that we can tell the change is happening, one which I already mentioned is that they're becoming more internally focused. And what I mean by that is not that they're just getting self-absorbed and doing nothing but thinking about themselves in a selfish way, but rather it has to do with, are they becoming more self-aware? Are they aware of their thoughts? Are they aware of their feelings? Can they name their emotions? Are they aware of their physical states? Do they notice when they're hungry or when they're tired or when they need to rest? And then are they managing themselves better? You know, are they learning how to self-soothe? They don't always need their partner to be the one doing that for them always. So it's really the shift to more of an inward focus. That's one way that we can tell. Oftentimes, because of that, they tend to settle more. They also have less anger. Anger is not a cause of abusive behavior, but it is a symptom of this belief system.
Right. Yeah.
You know,
That's a good question again.
Yes, and we can go and get back to that too. But in our program for our group attendees, much of the time, anger is another emotion plus blame.
Yeah.
So they have an emotion behind the anger, like sadness or embarrassment or fear or hurt. And rather than sitting with that emotion inwardly focused, they look outward at what caused that and they blame them. So I'm mad at my daughter for scaring me. I'm mad at my wife for embarrassing me. So rather than sitting with my fear or sitting with my embarrassment, I look outward and I blame them out there. So I think that's certainly one way we can tell that they're more aware, that they're able to kind of focus on where their true power is, which is over themselves rather than over others, that they're actively seeking to be collaborative, to work with people, rather than working against, most of all, their partner and their kids. And they're more mindful of the people around them and more thoughtful about them and more relational. So these are some of the, I think, the qualities that are tells that they're changing. Yes, there's also a diminishing number of abusive behaviors as well. The number of times they're controlling are dropping down. So certainly there are those concrete changes as well. But more, it's really how they live in the world and a real change in their lifestyle.
You know, you're talking about psychological abuse. I think that there's so much impact of psychological abuse that goes underthought about, I guess, maybe in the popular culture, maybe even in corrections. You know, you can look at, you know, somebody got hit, they got a bruise, but somebody gets hit emotionally over and over again, the impact of that can be so profound. And so the idea of when they're in a stressful moment in time and they still act respectfully, when they're in stress or in their life or in conflict and they still keep choice intact, those to me are real concrete changes that,
Yes.
that are really powerful to see and really give me hope that this person is going to carry that with them. And it's subtle, but really important is the way I would describe that.
Yes. Yeah, I agree with that.
Okay, you know, these are some great things. There's so much here we could unpack. What would you say to someone who says, you know, should we provide this treatment or not?
Well, I think you've got to, if you're serious about stopping abusive behavior. Now, you know, the domestic violence movement in this country and around the world only really emerged in the mid 70s as any kind of organized movement. And it was focused on the most immediate need, which was on people who were getting seriously abused, primarily women, and secondarily their children. And so we had battered women's shelters appeared, we had survivor services, and that's all very, very important work. It's very important ways of helping folks. However, in helping a survivor get safe, that can create the false impression that there's no more danger for anybody else. But there's no reason to think that most abusive partners, even if the person they're abusing now were to leave or to end the relationship, that they would stop their abuse and not continue on a new relationship.
Right.
So if we're serious about stopping domestic violence, we have got to address one of the core causes, which is the people who do it, the people who cause the harm,
Yeah.
the people who are doing the abuse. And that's really what abuse intervention programs are focused on, is the individuals that are doing that and helping them make changes. So I think it is vital that we need to focus on these folks. And we don't have all the answers. And certainly we don't always create the changes that we want. But it's really what we've got to do in part. Now, I also think it's important to look at the larger social conditions that create these things in the first place. So it's really about not only do we deal with the individuals that are doing this behavior, but also the larger social structures that support this. And while this is not an addiction in any way, much of what has been done within the substance abuse field there are parallels in the abuse intervention field. Yeah. And so just like we can acknowledge that society can promote sobriety or can promote addiction, in general, US culture is very much kind of pro-addiction in various ways. It's all about immediate relief, avoiding uncomfortable feelings, quick fixes, things of that nature, which is all supports addictive behavior, avoiding your feelings. Part of it is also creating social change where there's room for sobriety, and sober living is supported in a broader way. And we've made some of those changes. We've got ways to go still, but we're certainly farther along than we used to be. So it's the same idea. It's not only about with abusive behavior. It's not just helping individual people who are abusive. It's also changing larger social structures and social values as well.
One of the things I remember you saying a long time ago that really influenced me on this question was, it's not whether DV treatment works, it's what works. You know, does putting them in jail stop abusive behavior when they get out? Particularly, does letting them go work? Does, you know, what's going to work? And whenever I talk about this topic to groups, I start with saying it's very, very important to support victims and to support victim services, but also understand if you want to stop domestic abuse, you have to work with the people committing it.
Indeed.
You have to address the people that are committing it. And what, you know, there's a couple other questions I didn't ask you that I want to ask you. What do you think is the correct length of treatment?
Well, that's complicated as well.
Give me a short.
Yeah, what I would say is honestly, so my goal ideally, it goes back to that if they're still in the relationship, the partner feels consistently safe and consistently free, able to make their own choices, and it feels, you know, and they feel connected. And that's kind of that gold standard. Honestly, the length of treatment is totally measured in years.
Yeah.
I wish it could be faster and shorter than that. But in terms of that kind of standard, for most of our folks, it takes years if they can do it at all. Now, some can never get to that point. Some just don't have the courage, don't have the commitment, don't have the drive to do that, or motivation. But those who are serious about making changes, they can make changes. They're serious about it. But it's not something you can do in just a few days or just a few weeks or even a few months.
Yeah.
Now, to get, I think, rid of now most programs in the United States are much less than that. Typically, I'd say most programs are between 6 and 9 months, 4 or 5 months on the lower end, up to as long as a year on the higher end. That's what we're seeing on the West Coast, pretty much. Our programs in the area of a year long, and you can certainly do some stuff in a year, but some of the more subtle, longer-term work typically takes longer than that. And the analogy, Bob, that I use is we aren't just trying to stop behavior, we're trying, or even change their thinking, we're helping them develop a new lifestyle. Yeah. And this is a lifestyle that they've been practicing for many, many years. They didn't get this way overnight. They're not going to change overnight. So it is longer term. And I say it's akin to developing a trade or getting an advanced degree. You know, I'm a psychologist, and I can see the difference. And prior to graduate school, the way that I thought about human behavior, the way I looked at people, even some of the work I was doing in psychiatric hospitals prior to getting my advanced degree. And then I look at how I think about human behavior post-graduate school, and there's a huge change. I think like a psychologist now. In fact, I will think like a psychologist for the rest of my life. It took me years to get that doctorate. This was not something where I could read a few books and now I'm a great mental health professional. Typically, most graduate degrees take at least a couple of years, if not longer. Trades, if you include not only the actual formal teaching that you get, but the hands-on experience, again, we're talking about years. It's not like you can become a plumber overnight or think like a plumber overnight, become a landscape designer overnight. And so it's the same idea is developing like an advanced degree in how to be respectful. And that takes a while.
Yeah, there's a few things I want to add to that. I see a qualitative change with people who stay well past a year, without a doubt. This is just absolutely true. One of the things I teach in my class is what I call 4 global areas of change. And one is learning program tools, one is dealing with belief systems, one is lifestyle and self-care, and the last one is brain chemistry, looking at new pathways in the brain. Whereas one pathway is I get upset, I yell at you, or I push you, or whatever. And a new pathway is I get upset and I do something respectful, or I take a time out, or I find a way to deal with it in a healthier way. And I believe that pathway takes quite a bit of time to really develop and really practice, like throwing a curveball, like a trade, like you're saying. It takes a lot of time to practice a new way of responding, a new way of being, a new way of showing up, a new way of dealing with internal feelings. And all the things you're saying are, I'm finding that to be absolutely the case. So I love hearing that. If there was a victim of domestic abuse watching this video, what would you like to say to them? What do you think would be important for them to hear?
Well, the first thing is, contrary to what you've probably been told, none of the abusive behavior that's been done to you is your fault. You have 0% responsibility for the abusive behavior that's been done to you. It's 100% the responsibility of the person who was abusive. Now, that's not to say that people who are abused are perfect individuals or they don't have their own struggles, but none of the things they do mean they have to be abused or that they deserve to be abused. So none of the abuse that's been done to you is your fault. Even if you did have make your own mistakes or have your own moments of behaving imperfectly, the other still chose to respond to those imperfect moments by becoming abusive. They could have responded to them by not becoming abusive. Okay. Similarly, the other person is 100% responsible for their behavior. So I think that's one important thing to know. A second thing is that many people who've been abused think of violence as being physical assault, causing injury, causing pain. And if they can't check those boxes, then they really aren't a victim of abuse. And the vast majority of domestic violence involves non-physical abuse, involves verbal abuse, emotional abuse, controlling behaviors, psychological abuse, financial abuse and control, things of that nature. And it's a lot of much more common and subtle stuff that you may not be used to thinking of as violence, or verbal violence, or psychological violence. What they all have in common is they're all forms of disrespect. They're all ways of being disrespectful towards the other. So I think it's kind of broad that way. I think that's another important thing to know for victims of domestic violence. I think part of it is becoming more aware. I think a third thing is understanding this belief system. That's why I recommend The Verbally Abusive Relationship by Patricia Evans so much, because she describes so well. And part of this is understanding that most victims of violence are in personal power. They believe in kind of working collaboratively. They presume their partner's on their side, and they assume their partner thinks the same way. That's true if you have a partner who's not abusive. But abusive partners simply do not think that way. They think in power over. This is partly why the big reason why they're abusive is they're very much viewing the other as being against. And so realizing that the two of you are in different worlds, different realities, your abusive partner is in power over, and they mistakenly think you are as well. And you're in personal power and mistakenly, although understandably, think they're in personal power as well when they're not. And so it's really understanding that mindset and realizing that they don't share your mindset, which is why they respond in ways that you never would, because they have a different mindset. And I think the final point related to that that's important is that in order for a relationship to be collaborative, in order for a relationship to be non-abusive, both people need to be in personal power. If one person's in power over, so goes the relationship. So I think these are a few important things for people who've been abused to know.
And one thing I want to add, I agree with everything you said. I really like what you said, or like the way you phrased it. I want to add one more thing. When we talk about the antecedents of abuse or what might be causing abuse, there's no way are we just saying that that makes it okay. Or in no way are we saying that's an excuse, or that means it's permission, or it's a rationale. It's simply trying to understand behavior so that we can change it. And I just wanted to add that. We got two more questions.
Let me add one more thing that's really important for abuse partners to know, is because typically abuse partners try to get all kinds of help. They seek out couples counseling. They may seek out pastoral support through their clergy.
Yeah.
They may talk to their doctor. They may encourage a partner to get individual therapy. And what we know is that all these individuals will do their best to try to help, and most of them aren't going to be very helpful, at least not when it comes to abusive behavior. If they're serious about stopping their abusive behavior, they need to get involved with a program that specializes in abusive behavior.
Yes.
And it really needs to be group work.
Yeah.
Individual work just is marginally effective, if at all. And so I think that's another important thing.
That's my next question, is if there are therapists listening to this, and particularly couples therapists listening to this, do you have some words of advice for couples who are couples therapists who are encountering couples where power and control and abuse issues are present?
Yes. Well, the first thing is that unfortunately, most programs, graduate programs, do not teach about domestic violence.
True.
So
it's increasing.
It is increasing a little bit, but still most don't, and most don't adequately train. So the first thing I would suggest that every couples therapist should be doing is doing a good screening for domestic violence.
Yep.
And that would involve interviewing each person alone. You do not ask about abusive behavior when both people are present.
Right.
So hopefully, for obvious reasons, why that would be a mistake, because there could be major danger if a person who's been abused discloses that in front of the abusive partner. So number one, you need to screen for it. And you need to understand that it's common among couples seeking out couples therapy. There's been research that's found that a modest majority, not just a few, but even a slight majority of couples that seek out couples counseling have domestic violence present. Mm-hmm. One of my critiques of various couples orientations, and again, I've had a lot of training as a couples therapist, I do couples work, is that most couples orientations assume that people are collaborative. They assume that the two people in a relationship are collaborative, and they go from there. And that's a fine assumption much of the time for the general population.
Right.
The problem is that when there's an abusive relationship, it's not collaborative. And that's why couples counseling has so limited effectiveness when there's abuse present. So you need to screen for abuse. You need to screen for not just physical abuse, but the other patterns of abuse. If you find it, you need to understand that your couples work is likely to have minimal effectiveness. And this is no different than what's widely acknowledged now. It didn't used to be, but it is now, that you need to screen for substance abuse. If somebody's got an active addiction going on, if you're seeing a couple and one of them is getting drunk every night, for example, your couples work is going to be minimally effective because somebody's not in an altered state much of the time.
As is your regular counseling.
Yes, indeed.
The state of Washington a while back did a fatality review, and one of the findings they came up with is that couples therapy for domestic violence is 26 times more likely to be lethal, meaning fatality.
Huh.
That was the state of Washington that did that study, and they said it's 26 times more likely that somebody's going to die from doing couples counseling with domestic violence. Now, that was a while back. I do think there is a danger, and we could go through all the reasons why. I want to throw out a plug. The co-owner of our agency, Debbie Tomasvik, wrote an article that was published by the Southwest Washington Marriage and Family Journal on how to screen for domestic abuse relationships, and that is on our website. And we'll have a link to our website down below. But yeah, it's not just that it can be ineffective; it can be dangerous.
I would definitely agree with you, and most couples therapists do not adequately screen for it, and they don't intervene appropriately when they find it, if they even screen for it in the first place. So it's a huge concern. And by the way, it's also one of the reasons why couples counseling has such limited effectiveness.
Yes.
And I don't think that it's intrinsically ineffective. In fact, I think that, again, there's lots of value in various orientations. Where you get that compromised effectiveness is you're trying to do it with couples where there isn't a collaborative relationship. And if you were to remove those couples, which are close to the majority of the couples you're probably seeing, then I think you'd see your effectiveness of the things that you're trying to teach would jump up much more.
Debbie and I, the co-owner of our agency, we used to facilitate the Southwest Washington Marriage and Family Therapy Networking Group, which sometimes would have 20, even 30 people attend. They weren't all marriage and family therapists, but most of them were. And I was always impressed with how many marriage and family therapists were unwilling to see families or couples.
Yeah.
And I believe the reason they were unwilling to see couples, primarily couples, is because they were running into what we know is that power control issues are so prevalent and the therapy was ineffective and even possibly made things worse. And so they decided to stop doing it.
Yeah.
And I just found that interesting that you'd have 30 marriage and family therapists in a room and maybe 2 would work with couples.
Yeah. Yeah.
So
That's really
for what
something.
that's worth, that's not a research study, but just what we've observed that we found interesting. Okay, I got one last question. Tell me a little bit about this.
Sure, you bet. So I'm happy to talk about the book Becoming Allies, and it's really kind of a self-help book, and it's for people who are abusive. So people who struggle themselves with being abusive. In part, it can be used like a textbook in a group, in a program. So for example, at our agency, as you might imagine, this is now required reading for everybody in our groups, and it is organized so that you can kind of focus in different chapters. There's a chapter on sexual abuse, there's a chapter on denial, there's a chapter on shame, so you can kind of have a focused work on that. So it can be used, to support programming. Some programs do require books to be read, and this I think would be a great book for that. Yeah. It's very comprehensive. It's covers a lot of ground. Secondly, it can also be used for people who are not yet into programming. So it's not unusual for people to be encouraged to get help, including maybe doing some reading. So for people who are not yet in a program, and I make it very clear periodically throughout the book that this is a place to get you started, but if this is relevant for you, you really need to seriously consider getting involved with the program. This is not intended to be a substitute for going through a program, but it's something that can prepare you for that and help you do that much better in such a program. So it's also for people who are not yet in programming to read on their own. And that way it's like a self-help book. I think it's also very relevant for professionals who are doing this work. A lot of the learning that I did, I wasn't reading stuff that was in journals. It was reading books for the general public, like The Verbally Abusive Relationship, or When Good Men Behave Badly, or I Don't Want to Talk About It, as examples of some other books. And so likewise, I think this is an appropriate book for professionals who do this work. I think that there's learning to be had there.
Yeah, I was going to plug that.
Yeah, and you're welcome to. And then the last population that's not the intended target, but I think can also benefit are people who are being abused.
Yeah.
And have already had, from an earlier manuscript, had some abused partners read it. They found it very validating. Yeah. It really spoke to them well. So even though they're not the intended audience, I think it can speak to them. Also, the book is written without pronouns. So even though the significant majority of domestic violence is done by men, as we've acknowledged, women sometimes can be abusive. We also know that it's also just as prevalent in LGBTQ relationships. So, most of the books out there on domestic violence primarily focus on women as victims and men as perpetrators. And this book removes that gendered piece of it so that whatever your gender may be, and then also in heterosexual relationships. So whatever the nature of your relationship, it's relevant.
Yeah, I wanted to plug the idea for helping professionals, clearly therapists, but counselors, teachers. This is, in my opinion, this is so clearly written and easy to understand in such valuable topics that I think everybody in the helping professions really needs this information. It's so thorough and so well thought out and so clearly and easy to understand and very important. And I can guarantee there's going to be a lot of information in this book that you just haven't thought of. And once you read it, you're going to go, oh yeah, that really makes sense. I mean, that was my experience, and I've been working in this field for a long time. And so I'm a big fan of this book. I'm really glad you wrote it. I'm really excited that you came and spoke with us today. Are there any last words you want to say before we close today? Or any other things that we didn't cover that maybe you might want to talk about?
I think it's all good. I think that for people engaging in these services voluntarily, if that's something you're struggling with, it takes a ton of courage. Typically, most people who coming in on their own with this issue are very anxious and potentially resistant to getting into group work. So it takes courage to get in there. But if you're serious about making changes, to put the time and effort and energy, and you get it through an appropriate avenue like a specialized group, I think you can make real changes if you're serious about that. So really want to encourage you to do that. And if you're in an abusive relationship or realizing that perhaps your relationship is an abusive one, remember it's not your fault, and it's really sorting out what you need to do to get yourself safe. And do what's necessary in that area.
I want to plug one more thing. Early on, after you and I had worked together and I got training from you, once I was off from that agency and you were off into your own agency, I went to a couple of your trainings that you provide. And anybody interested in working with human beings, those trainings are phenomenal. I don't know if they're done by Zoom right now, or if you do them in person, or if you will do them in person again, but those trainings are really phenomenal. They cover a lot of great material. And I just really want to plug that if you want to learn a lot about this topic, get in front of Chris Huffine and go to one of his trainings, and definitely buy his book. Thank you for coming today. I really appreciate you spending your time with us and on such an important topic. And thank you very much, Chris.
You're very welcome.
All
Thanks.
right.